This is very interesting topic, medico-legal aspects related to teleophthalmology. So I would like to thank Anantesh Pandey sir here for giving me this wonderful opportunity. If you see this image, you will realize the importance of telemedicine. So what happened in Ramayana? When Hanuman was sent to get Sanjeevani booty, he did not know which is the one. And since there was no telemedicine, Hanuman had to lift the whole mountain to save Lakshman. But is it possible in today's world? No. So WHO defines telemedicine as delivery of healthcare services where distance is the critical factor by all healthcare professionals using information and communication technologies for the exchange of valid information for diagnosis, treatment and prevention of diseases and injury, research and evaluation, and the continuing education of healthcare workers with the aim of advancing the health of individuals and communities. So telemedicine has been in fashion since the year 2000 when the smartphones started making their presence in the market. Then came the messaging apps like WhatsApp and Telegram to popularize it. I'm sure each one of us would have given medical advice to n number of your friends and relatives over phone all these years. So is this what is telemedicine? However, the practice was banned by many state medical councils. Despite all this, the telemedicine still flourished. Let's get into a little bit of history of telemedicine a bit. There was a case in 2005 where a patient died due to acute pancreatitis that was being managed by a junior doctor as per the advice of senior doctor over phone. And the court awarded a huge compensation on the ground that patient was given medication without proper physical examination. Another psychiatric patient who was prescribed injection Serenase over phone died of cardiac arrest, and the compensation awarded was again very huge. Another case from Maharashtra that was observed was of a couple who were treating a pregnant lady over phone. The case went to the High Court and then to the Supreme Court, where the court stated that treating the patient over phone without physical examination amounts to gross negligence. So there are too many concerns when it comes to telemedicine. Who should be doing the telemedicine and for whom can it be done? What medicines can be prescribed? How to generate a prescription? What about the consent? How to maintain records? What if there are any complications? What is the liability of the doctor? And most important, how can an emergency situation be handled? COVID has set few things wrong, but few things were set in right direction. Board of Governors on 25th March 2020 superseded what was given in Professional Conduct, Etiquettes and Ethics Regulation 2002 and showed a different way to telemedicine, enabling registered medical practitioner to provide healthcare using telemedicine. It gives the same criminal and consumer liability to RMP as treatment given in person. So they categorize the drugs into various categories. This is the most important part of the presentation. It's important for us to have clarification on these categories of drugs. So first is category O. Paracetamol, ORS, multivitamin comes in this category. Also, medicine in case of any emergency, Government of India says everyone should take. For example, anti-malarials will fall in this category. Then there is list A medicine. So for these medicines to be prescribed in the first consult on telemedicine, you need to have a video consultation. It's important for us to know that ophthalmology eye drops such as ciprofloxacin falls in this category. So for us to prescribe these medicines, we need to have first video consult. This category also includes refill medicines, like if the patient is already on certain medicines, say anti-diabetics or antihypertensives. Then there is list B medicines, which are add-on medicines. Say patient is already on anti-diabetics and you want to add another medicine, then this falls in list B. So be very clear with list O, A and B. The prescription that has to be generated has to be exactly in this format, and it is clearly mentioned on this that this prescription is generated on teleconsult. So next question is, who can do telemedicine? So according to the notification, anybody who is enrolled with the State Medical Council under IMC Act 1956 can practice telemedicine. It was also specified that there will be an online course which one has to take, and the course will teach us about the details of telemedicine. The course is expected to be available in 2024 and we are keeping an eye when it comes. What are the fora that can be used for telemedicine? So one can use video, audio, text messages, etc. for telemedicine. For us, what is important to remember is ophthalmology drug falls in category A. So when we have to have video, we'll have to have video consult. So what cannot be done on telemedicine? First one, you cannot start a video call and tell someone how to do a phago surgery. You cannot provide consultation outside the jurisdiction of India. So let's say you have a patient from USA. You have to advise the patient to go to the local doctor and get the treatment. Better to ask the patient that you can see your regular doctor. There are 4 types of telemedicine practices that can happen. Are patient to RMP, caregivers to RMP, RMP to RMP, and health workers to RMP. The guidelines to practice telemedicine are very well described in the manual which was generated by Boards of Governors in 2020, and they specified 7 elements to be considered before any telemedicine consultation. And this document is available online, so you can download it and read it. Identity of the patient is very important in telemedicine. RMP should know the patient and the patient should know the RMP. If the patient is a minor, teleconsultation is allowed only if the minor is consulting along with an adult whose identity needs to be asserted. If the patient initiates the telemedicine consultation, then the consent is implied. But explicit consent is needed if a healthcare worker initiates a teleconsultation. Consent can be in the form of video or email, or you can send a consent form to the patient for signature and then patient sends back to you. All the consent forms are to be attached in the patient record, and to remind you, these records are to be kept as per the MMC guidelines for 3 years. Yes, as usual, it is on us when it comes to legal liability, so be very, very careful when you do the telemedicine. What is the definition of misconduct in telemedicine? RMP is insisting on telemedicine when the patient is willing to travel to a facility or request an in-person consultation. Misusing patients' images and data, prescribing medicines from the specified restricted list, and penalties for misconduct under telemedicine are as per the IMC Act. All the records for telemedicines are to be kept for 3 years. All the other rules and regulations of physical consult are applicable to telemedicine as well. Fees can be charged as you charge for your physical consult or whatever you feel is appropriate. You can generate receipt and or invoice for the same. So to summarize the legal aspect of telemedicine, doctor can choose the medium of teleconsultation. Doctor has to maintain same standard of care during teleconsultation as during in-person consultation. Patient is responsible for the accuracy of information. Caregiver is deemed to be authorized on behalf of minor or incapacitated patient. Doctor should maintain patient record for teleconsultation. Patient's personal data should not be disclosed or transferred without written consent of the patient. And doctor should not deny emergency teleconsultation but limit it for immediate assistance or first aid. Thank you.